as many of you know that there is a huge gap between access, supply and demand to assistive technology in Africa. And for example, according to World Health Organization's estimates, only 5 to 15% of people who live in low and middle income countries that require the use of assistive technology have access to one. And we know that assistive technology is critical to enable people with disabilities to participate in society and to live a meaningful life. And there are several reasons why there is issue with access. So we'll be diving in detail about the challenges and also what are the innovative solutions and the work that's being done by various stakeholders throughout Africa. So here we have 3 panelists, Muhidin, Abdulla, Becky, and Nanagandu. So I will invite them to introduce themselves. So maybe I will start with Nanagandu.
Thank you. Hello, everyone. My name is Nangandu Chizyuka, and I'm a program manager at Clinton Health Access Initiative in Rwanda. Our work is focused on strengthening systems around improving access to assistive technology. And today I am dressed in black shoes, black pants, a black jacket, and an animal print shirt. And I'm black African lady. Thank you so much.
Thank you. Hi, everyone. My name is Muhidin Abdulla. I work for UNICEF Supply Division, which is a headquarter division that's based in Denmark. My position is innovation specialist for assistive technology and disability. Mostly we work on programs toward enhancing access to assistive technology for LMICs, such as low and middle income countries. And today I'm here to talk about the effort we are doing in terms of our program and how are we trying to enhance this access. I am wearing, I'm told this is, I say it's blue, but I'm told it's navy blue, and I think a tall African male, 40, I think, yeah. Over, thank you.
Good morning. Yes, so you're alert. My name is Becky Mwangangi. I am a Kenyan, a physiotherapist by profession, and I work with Motivation. Motivation is an organization that is based in the UK, but we have different parts of Motivation in different countries. And so in Kenya, we are dealing with appropriate wheelchair provision, and I'm happy to be here to talk about AT because AT is unique, AT is great, and we can't wait to have this conversation get somewhere. Yes, I am a lady, a female Kenyan in a gray dress and a pink blazer and black shoes. I am black, but light-skinned. Yes.
Thank you so much. So I would like to start the session by asking about innovative solutions in light of improving access to assistive technology. So what are some of the innovative solutions or the work that you are doing with your organization to improve access to assistive technology in diverse African contexts? So I would like to address this question to all of you. Maybe I'll start with Nana. Yeah.
Thank you so much. So in Rwanda, where I'm currently working, following all the work that was conducted to have the assistive technology capacity assessment, rapid assistive technology assessments, one of the key issues was unavailability of data for persons with disabilities. So we worked with the National Council of Persons with Disabilities and the Ministry of Health and other stakeholders to develop a disability management information system. And the purpose of this system is to serve as a registry, case management for persons with disabilities. So we have information on persons with disabilities all across the country will be registered in this system and categorize according to their limitations. So the analysis, when this data is collected, will be to have limitation profiles for all persons with disabilities. And this will eventually feed into different information systems like health, agriculture, education, to ensure that the needs of persons with disabilities are catered for in terms of all services and all aspects related to provision of assistive technology. So this is great innovation for us, as it will lead to development of policies that are more inclusive, because it's a multi-sectoral information systems. Thank you.
Thank you, Muhidin.
Thank you, Zelalem. For us at UNICEF Supply Division, I think some of my colleagues who were here before on this platform talked about the barriers to accessing assistive products or assistive technology. One of it is cost and availability of the products, and also infrastructure. So I know there are also so many other barriers, but I think at UNICEF we are trying to address these barriers. One of the ways we actually do is we have a global catalog of products where we have a long-term agreements with global suppliers for assistive products, and we renegotiate the cost of those products to actually reduce those products to an affordable price, I would say. And I can give you some example of we have hearing aid in our catalog right now, and one of the UN organizations in Tehran, in Iran, bought that products through us. The price of a hearing aid for 1,500 USD in Tehran through UNICEF Supply Division, there is a significant cut in the price to $70. That's 94% cut in the price. So this is a global initiative that UNICEF is doing, and it's open. Our catalog is open to all. It's only not for individuals, but also corporates. So corporates who want to make interest out of those catalog, and individuals who want to buy cannot have access to our catalog. But for CBOs, NGOs, national NGOs, UN agencies, and the government, our catalog is open. So currently, we have hearing aid and wheelchairs in that catalog. I will share the link with you for those who are interested to procure. And by the end of December, we are adding vision products, which actually we have the tenders open right now, call for the bid with global suppliers. We have incontinence products, we have inclusive education products, and we have digital assistive technology products. That's around 180 products will be included into our catalog by the end of 2024. So it's open, it's free for government and UN agencies. You don't have to do any procurement process. It's open to anyone, and anyone can actually access our catalog. So besides that, we do a lot of advocacy when it comes to quality of the products, and also making sure the products are appropriate. So an example of quality of the products, all the products that we add into our catalog are as per the global standard. And we do a joint UNICEF, WHO, LTA, which means that we make sure that the standard is followed as per required. And when I talk about appropriateness, I think it's also providing advocacy, where we do workshops at regional level for government offices and government officers to make sure that when products are provided, it's actually appropriate and not causing more harm. And an example of where we have a hospital wheelchairs is provided for a child with cerebral palsy. I think that actually causes more harm. And so we are actually at the lead trying to advocate that if products are actually provided, it should be appropriate and it should not cause more harm. Thank you.
Thank you. Yeah.
Thank you. I would echo his words and say that he said quality, appropriate, and good standards. Unfortunately, when the cost is there, it doesn't go together, right? So you don't get cheap when it's good quality and proper standards and appropriate provision. So AT, the discussion on AT is broad, and I would like to say that the most important thing would be for policymakers to make sure that we have standard, good, and appropriate AT for the people in the world, in Africa, in Kenya, in everywhere. So however much we sing the song on AT and appropriate provision of AT, it is important that it's paramount that we all look at the direction that we can go together. Let's not work in silos. Let's not have motivation doing their thing that is appropriate. And if you go to a county hospital, for example, they're not doing the appropriate thing, right? It doesn't make sense, because if motivation is funded for an appropriate assistive technology, what about someone who has not heard about motivation and the only thing they know is the county hospital that is near them, for example, in Baringo? So they go there, they're given, for example, a wheelchair, because that's what I'm working with and I know best, a wheelchair that is not appropriate. What are they going to do with it? The healthcare providers, what do they know about appropriate provision? Are there policies that govern whatever it is coming into the countries, to Africa, to Kenya, to Uganda? Are there appropriate policies to standardize these things? Because, again, one person one time told me, it doesn't make sense that I have to pay for a prosthesis and I don't have to pay. I have to pay for tax for a prosthesis and I do not have to pay for tax for my car. What do I need more? Do I need the car more? Do I need the prosthesis more, you know? So some of these discussions are what we should be able to discuss broadly with policymakers and standardize a lot of things that we are going to be bringing into the country and every other aspect of AT. I was just telling a friend of mine today that, do you think sign language is part of AT? That's a question people ask. What do you think? Do you think sign language is part of AT? So how many sign language interpreters are there? If you go to a hospital today without a sign language interpreter and you're deaf, what's going to happen? You will have to look for someone you know who can interpret to you, right? So that person you know might know another person you know. Maybe you have a disease or a diagnosis you do not want to expose to people. What will happen? There's compromise, right? So there's a lot of discussions we need to, a lot of things we need to implement instead of talking too much about them and saying, oh, this is what should be there, these are the policies that should be set. When are we going to set them? That's the biggest question.
Thank you so much, Becky. I'm glad that you raised the issue of policy. So lack of governmental or proper governmental policies is one of the barriers that prevents people with disabilities from accessing assistive technology. And policies are a set of principles, and they guide action, and also they provide a mandate for equitable access to assistive technology. And I remember before 3 or 4 years ago, we did a scoping review on assistive technology policy in African countries, and there was a huge gap. In some of the countries, there is no policy, and where there is policy, there are also issues with the policy. So maybe since Clinton Access Initiative works closely with governments, I would like to ask, so how are assistive technology policies being developed and implemented in Africa? And also, how can we ensure or foster collaboration between government and non-governmental organization and also assistive technology industries? So, yeah.
Thank you. So in the pathway to developing inclusive policies or policies for improving access to assistive technology, there are some barriers on the way, such as lack of platforms where the need for policies are discussed. Secondly, I'm sure from a lot of us who are working in this space, we can acknowledge the fact that we do not have sufficient data, sufficient information on disabilities, enough information to actually build as evidence for policymakers. So for us as a Clinton Health Access Initiative, we are investing in ensuring that fundamentals for building into policies are actually in place. And this includes ensuring that our partner governments have the required evidence to actually formulate policies. So that transition from evidence to policy, and this is why we are focusing on aspects such as building information systems for partner governments that will show who the people with disabilities are, where they are, what their needs are. Because it's not just enough to just say persons with disabilities, but the needs are unique. So how do we build systems that will go into to ensure that the policies that are developed in the different countries are actually inclusive and actually do meet the needs of the persons with disabilities? So what we've focused on is the issue of data, ensuring that there is evidence, in-country or coordination, making sure that there are platforms where disability issues are discussed, like technical working groups within the health sector and multi-sectoral coordination mechanisms. And we've also developed assistive product lists, which it's an inclusive process to develop the assistive product list. And through all that, there's a lot of advocacy. The process in itself does generate a lot of advocacy around disability and assistive technology. And earlier on, there was a session where we had the investors, the payers. That's another area. We need to create an environment that will attract people to invest. And that also requires us to ensure that our policies are really not just focused on the users of assistive technology, but also those people who are going to invest in assistive technology. So formulation of policies requires that we take a holistic approach in building fundamentals so that we can provide information that is required to the policymakers so that at the end of the day, we do have policies that meet the needs of persons with disabilities. Thank you.
Muhidin, would you like to say something?
Yeah, I think just to add with what my colleague said, I think also when it comes to policies, I'm just trying to be very practical actually with this, and myself, I think I haven't said this. I'm an occupational therapist and I'm from Kenya. One of the things is actually the standard of the products that we actually produce locally, and I have provided, I think, those products. We have to actually see how we can actually realize to make sure that whatever product is actually that's produced locally is actually of a standard. To me, this is actually a big concern because sometimes, honestly, I have seen a field where we have auxiliary crutches that are actually so heavy for even as a therapist to see that we can't actually provide that. So I think there are global standards and practices that needs to be done, and I think these are some of the things that need to be incorporated into our policies so that when we have local manufacturers, I think they should abide by these policies that can actually guide them to produce quality products. I think to me this is one of the things. The second one is, and I'm so trying to consider this to actually Kenyan context, is actually also the distribution of these products. I think when we provide assistive products, I think assistive products are not NFIs. They are not non-food items. These are products that you need to do, in-depth or individual assessment to actually provide this. But I think I've seen cases where wheelchairs are actually distributed, and I don't want to use this. They are provided. We don't distribute them. We provide them. We do assessment and we provide based on the need. But you see cases where there are sometimes on our medias, on the papers, and you see all those products that have actually been provided have actually caused more harm. So to me, it's a bit of a concern. It's something that has to have some guidance from the government in terms of policies to make sure that when those kind of provisions are done, I think there is an involvement of the different sectors, and that include, of course, the rehabilitation team, which includes the physiotherapists, occupational therapists, the orthopedic technicians, the wheelchair specialists, to be able to guide, do proper assessment, and provide what's appropriate. Thank you.
Thank you. So that means that the policies that we are going to develop should also include guidance for quality manufacturing and also for service provision, so that it will be guided and will be appropriate to the users. So let's go to community engagement. So the device on its own will not enable full participation. So the user, full participation is realized when the user and also their device is supported by empowered community members. So I would like to ask you, maybe Becky, a question on your experience on community-driven approaches to raise awareness, reduce stigma, and also to empower people with disabilities to advocate for access to assistive technology. Yeah.
Great, thank you for that. One of the things I like about the trainings we do at Motivation is that we like going into the grassroots. And I would say that there's no need of having to engage in something when you do not, when you're not involving the people who are actually affected. So one of the programs we have done before has included peer trainers, people with disabilities. And I will still use the wheelchair example because that's what we do. And so wheelchair provision is not just getting into a stadium and having a politician issue wheelchairs for people who need them, because then you don't know who needs what and for what purpose. So our peer trainers are really getting into the community and having conversations with people with disabilities and helping them understand stigmatization, what can I be able to use my wheelchair for, sexual health, because this is something that people do not want to talk about in our disability areas. One of our peer trainers went for training in India, and she came back and she was like, I tried to talk about sexual health and everyone was closing their eyes. And so basically these are so many other things that you and him cannot talk about, or myself and him cannot talk about to persons with disabilities, and they understand. They need someone who actually has a disability or able differently to help them understand, cope with some of these challenges. And so we also have our community social workers that we include, and artisans that we have trained to enable the wheelchairs that we give. There has to be sustainability. There has to be continuous use of the wheelchair. So if there's no proper maintenance and you have not trained people, for example, in Narok, and you issued a wheelchair in Nairobi, what do you think will happen in a couple of years? Maybe the funding is not there. They can't come back for another wheelchair. But then you have been able to train an artisan to be able to manage a wheelchair. They know what they need to do. And if it's not manageable, then they can be able to refer. So there's a referral system that is there for wheelchair provision. And I'll keep on insisting that a wheelchair is not just a wheelchair. You need to give an appropriate wheelchair. There has to be proper provision guidelines. So involving stakeholders and having people who make policies is quite crucial. Sometimes when we have these trainings for stakeholder engagements and managers training, we do them and then people come out like, oh, so you mean this is what is appropriate? And those are people who are leading organizations like hospitals. So you wonder what happens. One time, someone told us, actually, we use the wheelchair to carry laundry to the other side from the ward. And I was like, wow, this is not right, So community engagement is crucial. Let's not have these discussions within this space. Let's go outside there. Let's get the right people to talk to them about what is appropriate. Thank you so much.
Yeah, thank you so much, Becky. So I'll come back to Muhidin. So what are the main infrastructural barriers that hinder the production, distribution, and maintenance of assistive technology in Africa, especially with a focus to underserved areas, remote areas in Africa? So, yeah.
Thank you, Zelalem. I think one of the biggest infrastructure that actually the barriers that we have in terms of infrastructure is actually the physical barriers that we have. I think creating a barrier-free environment actually benefits the AT users well, because in a case of where we build barriers, the man-made barriers, where we don't have accessible hospitals, accessible hotels, we don't have accessible houses, we don't have accessible transport, I think, and then we provide assistive products without having a physical, we have also thinking about an environment-free barrier. I think that creates more challenges and more barriers. So I think one of the things is actually to create a barrier-free environment that's accessible for all, including our roads, including our pavements in the city centers, including the hospitals and how that I think makes more the person, the AT users more independent. I think the second one is also the issue of availability of the products. I think Becky is just explaining of an example of someone in Narok who has received a wheelchair in Nairobi. So probably they need replacement, they need maintenance, they need probably change. So they have all this. It requires maintenance and follow-up. So if there is no assembly or available somewhere where they can actually have access to get those spare parts or to come for that, I think becomes a big challenge. So I think creating more centers for rehabilitation or assembly in the rural settings so that we can be able to reach out to more people, so that people don't have to travel all the way to Nairobi just to get a spare. I think also it's a good approach when we want to address the issue of infrastructure. And I want to share an example. We did a piloting of hearing aid in Rwanda. And actually, after the piloting, I think there was a realization that you see with the hearing aid, we have digital hearing aids, so we have the ear molds. So the ones that we have in the ear. So that ear mold actually has to be changed every 3 months. Every 3 months. So we can't depend on the same supplier from the US to actually ship those ear molds every 3 months to a child ear, because the ear keeps on growing. So I think we thought of while it's actually easy to actually buy the equipment and train some artisan for 3 months in the country and be able to have those ear molds in different corners of the country. So it's actually something that's achievable. So I think we need to focus more into also developing the African infrastructure so that we can be able to have access to spare parts, we can be able to have access to products, we can be able to have access to centers or for maintenance of those products. But also I think motivation is here. I think it's a global company. There is also now the push for local assembly, I think which is something that is being worked now. On our side, we have a lot of LTA. We have LTAs with global suppliers for wheelchairs and other products. And I think Motivation is one of our partners in this. And we are trying to discuss this. How do we reduce the cost to actually have assembling points in Kenya, in Harare, in South Africa, in Rwanda, so that at least this can reduce the cost of the products. Thank you.
Thank you so much. So we have only 1 minute left, but I would like to ask maybe Becky on capacity building, especially for healthcare providers to be able to properly prescribe and fit and maintain devices. So what are some capacity building approaches or work that you have been doing? So, yeah.
Okay, thank you. I'll try to take the 1 minute. So capacity building is crucial. It starts from down there, not up here. And we did a lot of trainings for healthcare professionals once they have left school and gotten into the field. Unfortunately, these professionals who are already in the field are busy. So they don't get time all the time to have an exposure to trainings and stuff like that. So I am glad that partnerships do work, because a partnership that we have with Jomo Kenyatta University has actually created an environment where capacity building is starting from the grassroots when the students are learning. So we have the rehab team getting to understand On wheelchair service provision, we have the students, everything is put into the curriculum. That is very good for us in the AT space. So they get to understand these things from the classwork. They get into outreaches, they see that wheelchair provision is crucial and how difficult it is outside there. So capacity building should be done. It's a continuous process, and continuous medical education is something that has also to have data. So proper research done. I would say that it is important for research to be done in AT, because data will enable even the policymakers make the right decisions for these type of things. My 1 minute is done, as much as I would have so much to say. Thank you so much.
Yeah, unfortunately, due to time, we can't. But I would like to thank the panelists. Thank you so much for your expertise and providing your opinion. I think, as we have seen, the issue of access to assistive technology in Africa is a complex one. It stems from lack of community engagement, lack of proper governmental policies, infrastructure barriers, and a lot of barriers. But I think one thing that, as a home tech message, I would like to say, solutions should be contextualized. So Africa should come up with its own solutions, so homegrown solutions for homegrown problems. So, and also very strong collaboration is needed. Yeah. So thank you so much for attending the panel. Yeah, thank you.
Thank you so much.
Thanks a lot. Thank you.
Yeah. Unless, of course, you want to stay and ask a question. We are ready for it. Okay.
Good. Thank you.
Oh, there's one there.
There is one?
Okay.
Yes.
Yes.
Yeah.
Hi, everyone.
Hi.
Hi, my name is Maureen Sharon Awino from Niro Kids Warriors. I would like to ask about the hearing aid. Abdul, you have talked about the hearing aid. So I would like to ask you, you are talking about 75%. Where hereby, we have some people who cannot even afford the 75% of it. So what are you guys doing so that you may help those who can't even afford even the 75% of it? And my question is to Becky. Becky, you are talking about giving a wheelchair for free. And how possible is it? Because right now we are trying to advocate on wheelchairs, like good wheelchairs, in terms of don't give somebody a wheelchair of which you know that it will again give him or her another disability. Is your team working on it? Like, if they're giving a wheelchair, do they do assessment on them? Another one for Abdul. I would like to ask, you are talking about the clutches are heavy. Can you do something to empower the local communities so that they may help you out in creating the ones that they can use? Thank you.
Okay, so Abdul has 2 questions. I'll go first so that he gets to do the 2 questions after I do that one. Yes, absolutely. So one of our key themes is, as motivation, is appropriate wheelchair provision. And why we introduced it into the curriculum is so that people would understand that the wheelchair that I would use, Abdul will not use it. So yes, we do assessment, prescription. It's actually a cycle. Like, someone walks in, we get to understand why they need a wheelchair. There's an assessment that is done. They're explained to what are the products that are available. Measurements are taken. They are taken through those things that would come, like you're saying, maybe a disability because of using a wheelchair. That training is there. And at JQuat, there's a wheelchair service center that actually does that. So after they actually trained with the caregiver on how they are going to use the wheelchair. And as much as we give them for free, if you cannot be able to use a wheelchair and you're not trainable at that specific time we are giving the wheelchair, we don't let you go home with it, because it will cause more harm to you than good. And this is why we are saying that capacity building is important, because people will always run to people that they think have the right information. So if they run to people who they think have the right information and those people do not have the right information, then they will be doomed. So we actually will be having a booth tomorrow, and some of the videos that will be running in the booth will be what we do in JQuat and the outreaches. And this is why it's so sad when people just give out wheelchairs like you've gone to the supermarket to buy bread. It's quite unfortunate. So if you get some time and pass through the booth, you'll be able to understand what we mean by appropriate wheelchair provision. I hope I have answered. You're welcome.
Thank you. I hope I can answer your question. So the first one is actually on hearing aid. What I was actually trying to address is actually the reduction of the prices globally. How we have renegotiated the prices with the global suppliers. Like now we have, out of 6 global hearing aid suppliers, we are having an LTA with 5 of them, five of them. And our terms and condition is those hearing aid will only be sold in low and middle income countries and not the high end countries. So, and I was given an example of how we have reduced the prices because we renegotiated those prices. So I just gave an example of one, I think, which was Iran. So in Tehran, one hearing aid that goes for 1,500, we sold them through our LTA at $70. That is 94% price cut. Another one is in Rwanda. We sold it at $118. That will go for around $2,000. So that's already, I think, a big step in terms of reducing the prices of those products. And it's free for the government. So the government of Kenya or government of South Africa or the government of Rwanda or Somalia or Ethiopia, any countries can actually use our LTA without having to go through a new procurement process to buy those products. So that's what I'm trying to explain. Where we are able to provide for free or be able to reach out to people who can't afford, I think this is a concerted effort to everyone. And of course, for us, we wish we can, but I think there's also limited funding. We have piloted in some countries with the small funding that we got, which they are getting for free. But I think if wishes, when we can be able to provide for everyone. But thank you for that. Your second question was, yes, on the standardization of the products. WHO and UNICEF actually developed assistive product specification guideline. So we have now did a specification for 26 products. It's free. It's available online. It's for everyone. And we have done global workshops to actually try to build the capacity of the government to actually try to understand these standards. So the APS document is there. We are trying to review that document. It's a living document, so we have, I think, around 70, we are moving to around 74, 75 documents. So this is a standard global documents. Anybody, any supplier, even for the supply team, if they want to do procurement and they want to see the specifications to make sure that the product is quality, and I'm giving an example, you want to buy an auxiliary crutch, you are from the supply team, you just don't know the specifications, you don't know what to ask for, you can actually just get the specifications from there. All the information is there, what's required. So it's a global document developed for everyone. It's available in all the languages, including recently for Portuguese. So it's available for everyone. So this standard is there. We are doing workshops and talking to different governments where we are to actually try to popularize the document so that they can actually adapt and be able to use it. Thank you.
Thank you so much.